Try and look human too. Good afternoon, Facebook. We are so excited to be on with you today. We have a exciting panel of just two wonderful guests that I am grateful to be working with. So we're going to go straight into introductions. But before we do that, I want to name that we are here today in order of Child Health Day, which was this week, and here to talk about issues impacting our children and our communities. So I will start with introductions. First, my name is Bernice. I am the Regional Director with For Our Future Florida in West Central Florida. So if you are in Tampa or St. Petersburg area, you are one of my neighbors. And just grateful to be on with our wonderful guests today. I will start by passing it to Allison to introduce herself and share a little bit about Florida Health Justice Project. Hi, Allison.
Hi, thank you so much for having me. It's really great to be back with all of you. So I am Allison Yeager at the Florida Health Justice Project, and at Florida Health Justice Project, it is our mission to promote healthcare advocacy on behalf, promote healthcare access on behalf of Florida's most vulnerable and marginalized residents, and also to address health disparities and promote health equity. So it's great to be here with you. Thanks for having me.
Awesome. Thank you so much, Allison. And we are very lucky to have you with us today. I would like to toss it to Lisa next to share a little bit about herself and Common Ground Project.
Thanks, Bernice. I am also grateful to be here and for the work that you all do. I'm Lisa Perry with the Common Ground Project, and we really work on a lot of policies in order to promote equity for working Floridians and working families. And so obviously, Child Health Day is really important, and this topic is really important to address some of what we're seeing around the state. And so thank you for inviting me to the panel, and I'll pass it back over to you, Bernice.
Awesome. And then last but certainly not least, my two colleagues, Juan and David. Y'all want to chime in and introduce yourselves?
Yeah, for sure. If you don't know me, my name is Juan Moore. I'm the Regional Director of the Southern Region. So that is South Florida, which would be Broward County, Miami-Dade County, and Palm Beach County. It's totally excited to be here to see Lisa and Allison. I consider them to be vets on this panel. And so I know this is going to be an exciting discussion, and I'll pass it to David. Thanks for having me.
Awesome. Well, also really glad to be here. My name's David, he, him pronouns, and I'm in the Orlando area for all the people in the East or Central side of Florida. So really excited to be here and working with all of our partners together on this panel.
Awesome. Well, thanks so much. We're going to go ahead and jump right in and start talking about our first topic today relating to child health, which is Medicaid expansion. So just want to share real briefly, the American Rescue Plan, which is a bill that our Senator Marco Rubio voted no on, actually offered incentives for states to expand Medicaid and bring health coverage to millions of low-income families across the country. So I'd love to hear just a couple of reactions from folks on the panel. Like, what do you think about when you hear that?
I can jump in. So Medicaid expansion is a huge issue for Floridians. Medicaid expansion was an opportunity created by the Affordable Care Act. And at this point in time, Florida is one of just 12 states that has not expanded Medicaid, which means that we have hundreds of thousands of Floridians who are stuck in what we call the coverage gap, meaning they earn too much money to qualify for Medicaid, but too little money to qualify for subsidies to buy private health coverage on the marketplace. So expanding Medicaid would address that coverage gap. And it would allow these hundreds of thousands of Floridians to access the health care that they need. Both our legislature and our governor have roadblocked opportunities to expand Medicaid at every turn. Year after year, the Florida legislature has failed to even hear the possibility of Medicaid expansion in committee. And this is really just political gamesmanship at the expense of the health of Floridians. So it's really frustrating to see that that this issue has just remained sort of a political chess piece when what's at stake is keeping our communities safe. And in the context of a pandemic, there's no rational explanation and no way to frame this other than just a failure to serve our people.
Yeah, absolutely. I totally agree with you on that. If we can move to the next slide, please. And part of what we're seeing here is that the Florida legislature is leaving $3 billion on the table by refusing to expand Medicaid. And we have 800,000 Floridians, and 343,000 of those are children who are left uninsured. So this is just another example, exactly like Allison said, of Republicans who are putting their party politics over our lives and our safety. I'd love to hear from you, Lisa, just your thoughts on like Medicaid expansion.
Sure, thank you. I completely echo everything that Allison said. And, I think particularly in the context of the pandemic and as we try to rebuild our communities and those communities who have been, disproportionately impacted, the failure to protect hardworking Floridians, hardworking families, and then, leaving 343,000 children uninsured is really, this is not an issue that should be political. This is I think our legislature and our representatives are here to serve us. We elect them, we pay their salaries. And, when they're literally putting people's health on the table as a chess piece, that is what it is. It's a political game. And it's just, I really want that message to be clear, because I think that there's an effort sometimes when, how the messaging goes out of, why there's not money out there to do Medicaid expansion, or there isn't, there isn't a need. And I think that we really, really have to continue to hold the elected officials accountable for our lives, and our safety. We are relying on you to protect children in this case, on this panel, what our main focus is, but also families across the board. And the fact that we're leaving $3 billion on the table is really childish, to be honest, in my opinion. I feel like, there's just no other way to cut that pie. It is what it is. And it really is putting political party and politics over the health and safety of working Floridians. And, that just leads us to ask, are these the folks that we want representing us in the future? And I think that we need to get that message out there, that there is funding for Medicaid expansion, that we can do better for working Floridians. And just, really shedding light on that is something that I think is really important.
Can I add something to Lisa's point, which is, I think, this is not necessarily an issue that every Floridian knows that their representative is making decisions about on their behalf. But, we're coming up to an election year, and people should be asking their representatives, what's your stance on Medicaid expansion? And you should be sure that you're happy with their answer. Because we are the people, as Lisa said, we are the people who are voting folks into office and who have the power to vote them out, and they should be representing our interests and our health. And when we think about child health and Medicaid expansion in that context, Medicaid expansion would help a significant number of kids, and it would also help a significant number of parents. And if parents can't stay healthy, it's a whole lot harder for them to take care of their children. So this is really a multi-generation approach to keeping families healthy. And it's like Lisa said, it's money on the table that Florida has turned away from year after year in the name of politics. And it's a disservice to our communities, and it's making us sicker, and it's making us less healthy, and it's exacerbating racial disparities in terms of health outcomes. So there's no more time for excuses.
And I think you're both spot on. And when I look at this, I see, in the words of Trick Daddy, which is a rapper here in Florida, he says, Trick loves the kids. Florida Future definitely loves the kids. I definitely love kids as a parent. And when I look at this, I see a trend that has been happening, especially during the pandemic. Our kids are often overlooked with the look at what they're going into in school. I see a lot of people, when they see Medicaid expansion, you look at the bumps and the bruises that kids have. But what about all of this, the mental state of the children and the parents included? And so that also, takes care of these places and these outlets that these parents and kids need to go and be available to, made available so they can get help with stress levels, with ADHD, all type of things fall under this medical day. So I just wanted to reflect on that. And going back into the trend again, our leaders have been proven to not give two iotas about what's happening to us, and especially it seems like nowadays our children, and we should be very appalled and be afraid and be ready to vote.
And I'll add real quick too that especially with conversations, I think this is a genuine disconnect between Republican voters and the Republican legislature, that when you talk to folks that are relatively conservative leaning and say, tax dollars have already funded this, like it's already there, and the difference that this would make for people that are under or uninsured, and then the impact that makes on our healthcare system. It makes way too much sense. And I think a lot of people just would say, yeah, of course we can expand it. It's already paid for. Well, then yes. And that's a disconnect that is definitely seen in the legislature when it's something like this that also just isn't getting passed, and it is, simply put, popular.
Yeah, and I was going to ask just to, as a general question to everyone, what does it mean for these 343,000 kids if they sprain their ankle or break an arm or, have to go to the hospital because they have a high fever? What does that mean for our communities when their parents are left with a huge bill at the end of it?
Yeah, I was going to say that's debt for family. And here in Florida, with the way things are set up and inflation, a lot of people can't afford to miss one check. It automatically sets them back when you're talking about utilities and in rent. So, I mean, it means a lot, a hell of a lot.
And, there was just recently a study that came out that looked at medical debt and compared levels of medical debt across states where they had expanded Medicaid versus states where they hadn't. And they found that, unsurprisingly, medical debt among families was a lot higher in states that have not expanded Medicaid. So this Medicaid expansion is not just a public health issue, as if that weren't enough on its own. It's also an economic justice issue because we all know how expensive healthcare is in this country. And without health coverage, we're essentially asking people to put themselves into medical debt if they're going to risk going to the doctor at all.
And also, like, additional stress on, community, our Florida as a whole, right? Because when we have uninsured sick folks going into the hospitals because they can't do preventative care, they don't have regular doctor checkups, this is putting strain on the entire system. So, it's not just an issue that affects one particular demographic of folks. This trickles down across the table to our economic status and where our tax dollars are going, across the board. So I also want to lift up that this isn't something that we can, certain individuals can just silo off and say, well, this isn't my problem, I have health insurance. We're all involved here. And as we grow and do better, we are only as strong as our weakest link. And that way, we are responsible for our neighbors. And I just wanted to name that, this affects folks across the board.
Yeah, and I think, thinking about how specifically it impacts poor folks in the community, just because it's expensive to be poor in this country. If you miss a tooth cleaning, that means you're going to have to pay for a root canal further down the road, And so just thinking about how important preventive care is and how much these bills are adding up for folks without access to this preventive care, it's huge.
And our business communities should also really be invested in everyone having health coverage, again, especially in the context of a pandemic. We keep hearing about how businesses are having a hard time filling open positions. And it's hard to imagine that a big part of that is not attributable to the fact that people are scared to go back to work in the context of a pandemic without access to health coverage. And people need to know that if they get sick, that they have a system behind them and a safety net under them to catch them. And so that they don't find themselves on that, economic precipice because of one hospital bill.
Yeah, absolutely. So I want to move us to the next part of our discussion, which is talking about the child tax credit. Would love to hear from folks. I know there are parents on the panel right now. So I'd love to hear from one of y'all, if you can share, what is the child tax credit and how has it been helping your family?
Absolutely. Well, the child tax credit was initiated by the American Rescue Plan, and it will be extended if the BBB gets passed. But it's a credit that's given once a month for the children within the household. It differentiates as you get to the older children. I don't want to misquote exactly what it is. Maybe Lisa, what it is. I let the boss of the house handle all of that. But we do know it is helping over 65 million American children. 47% of parents used at least some of the funds for food. We definitely used it for school supplies, additional uniforms, because our kids had to go into a different school format because of COVID. 28% used the money to help pay down their debt and ease their economic burden, and nearly a quarter purchased clothing for their children. And I was one of those quarters, one of those pennies in that quarter, right? So yeah, I mean, it's definitely relief. Again, it's not a cure-all or answer-all, and especially in a time of in a pandemic and living in Florida, being middle class, but it is definitely a huge relief. And again, this would not be so if it was up to our leaders, and it's shameful to say because both of them are from Florida, or so they say. The wiki says so. But it's a total shame, and if it was up to them, this would not be afforded to Floridians. And I know, Lisa, I saw you wanted to chime in.
Yeah, I just as a receiving the child tax credit in our household, it literally comes at the most perfect time every month. It helped to buy school supplies as we began. Circling back to failure of leadership at the state level, my children are still in virtual school due to unsafe conditions in the public schools. So I have been able to buy additional, supplies for them to be more successful in their education at home with this credit. And, I feel we've purchased clothes, we've purchased food. And really what is amazing is that this helps so many people across the board, as you pointed out, just meeting basic needs for kids to be successful in Florida. And I think that, another thing that I'd like to just piggyback on what you pointed out is that, our state leadership, as trying to roadblock a lot of this. Federal leadership, our federal representatives are not standing with these funds as well. And I think that what happens is then it gets passed, but you also need to pay attention to when they come back and then they try to claim, look what we're doing, look at how we're helping. So just piggybacking off of what you said, Juan, is that, this was passed due to a lot of effort and good folks out there that are standing up to make sure that this happened, but would have been blocked if it had been up to a lot of the Florida leadership. And but now I see across the board that folks are claiming credit for this. And so I would recommend to you out there, as we're looking at elected officials, to also notice how, voting records don't always match with what they claim credit for.
That's so interesting because it reminds me of the American Rescue Plan funds that were used to give bonuses to like teachers and firefighters. And the governor never supported that. The Republicans never supported it, but they were taking credit for like people getting bonuses. It was just very bizarre.
Yeah, and I just want to say to any of the more conservative viewers, and Lisa could attest to it because I know she gets it as well. Definitely still have my job. Was not able to go to Mexico with your child tax credit or any of the lavish things that are claimed by some of the right side. So it is definitely a help. Definitely still you have to have a source of income to adjust, but it's not being utilized like some people would like to be painted as being some sort of cush to just go ball out till you fall out, for sure.
And can I add to that this kind of idea is something that a lot of other countries have done or have a history of. And in this country, we sort of perpetually have a fear, that exact fear that you just named, Juan. And yet in places where they give child credits, not even necessarily tax credits, but regular payments to families with children, what is found over and over and over again is that those funds are used for basic subsistence by the family. And they're used for paying rent and buying food and buying school supplies and giving the kids maybe access to some sort of program that they might not have otherwise had access to, but to meet basic needs, which keeps the kids healthy and keeps families healthy. And yes, no one's using this money to take a cush vacation.
Yeah, absolutely. It's so important that our kids are equipped with the tools that they need to succeed in life. So this money makes a huge difference for families and being able to do that. And just seeing like 47% use some funds for food, like that's huge. That's huge.
Yeah.
Cool. So I'm going to move us to our third and final topic today, which is the very confusing child food aid program. So I'll tell you why I say confusing. This program was started in 2020 under Trump, and it provides 2.1 million children with critical support. So DeSantis reapplied for the program only after Democrats like us held him accountable. So originally the state was not going to reapply until folks said, hey, like that's not okay. Like children need resources and we need to reapply for this. So the state did reapply, but there's some confusion around whether they missed the deadline for the reapplication or not. So I share all this to say that once again, party politics was more important than feeding our children in the state. So I'd love to hear, Elisa, especially from you around like, how do you feel about this and all the confusion that happened with like the reapplying and then the failing to reapply and then the extensions. I know it was confusing for us to follow.
It's very confusing. And also, as you point out in the slide, this is a program that was started under the Trump administration. And so when we see, I think that there's intentional confusion as to why we're not going to apply. I also think that this demonstrates the voice that hardworking Floridians can have and the impact to push it forward. But it also just really highlights how our lives, are actually being used as political chess pieces now that we're under a new administration. All of the sudden we're not on board, we're missing deadlines. And I think that, what a lot of that confusion going back and forth and what were I would say American public, hardworking Floridians across the state are seeing is mixed messages coming in. So that's intentional, so that it is not quite as clear there's been a transition between something that was supported under a different administration is now, kind of not. And now we're not going after that. Oh, maybe we are. Oops, we missed the deadline. I think that these types of things are meant to take away power from the voices of Floridians across the state who are pushing for supportive programs like this. And it's harder for us to champion and engage what we want to see our representatives do for us when, there's a constant juggling and mixed messages going on. And as somebody who works on, policy across the state, as hard as it has been to kind of follow, for me, I can't imagine, somebody who has 3 jobs or is trying to make ends meet and trying to keep up with where we stand on this. And quite frankly, I think a lot of that has been an intentional power play to take away voices from Floridians across the state who have been pushing for this.
Yeah, I definitely agree with you. I do see it as like some sort of intentional confusion, just because, I consider myself relatively informed around what's going on because of the work that we do, but I myself was struggling to follow this story. I know Allison sent me a news story about it, and then I looked it up online and found a separate news story saying they missed the deadline. So it's like confusion, and it's confusion about our children. And that's something that shouldn't be. Our kids deserve to be healthy, to be able to eat, to have someplace to sleep. And so like all of this confusion just tells me that they don't value the lives of our children.
And the background on this program was it was initiated in the context of COVID in recognition of the fact that so many kids depend on school meals as a critical part of their daily nutrition. So many kids depend on school lunches, in addition, school breakfasts, and there was this recognition among our congressmen and women that when people were being forced to stay home, when kids were forced to stay home, that they weren't getting 1 to 2 meals a day from school anymore. And that was the genesis of recognizing we need to be doing more to ensure that our kids are getting the food that they need. And again, the fact that that becomes a political game, it's really shocking. And like you said, Bernice, this is a story of successful advocacy because the governor was leaving the money on the table this time around, and yet there was a swell of advocates' voices pushing for the state to accept the funds this time around. And there's no cost to taking these funds. It's just money to do the right thing on behalf of our kids, and we were letting it sit out there until enough people with enough volume said this is inexcusable. And then there was, the governor kind of couldn't hide from that at a certain point.
Yeah, and I think this just goes to show the power of advocacy. Like Allison is saying, how important it is that we stay involved and stay engaged in what's going on in our state and in our communities. So on that note, I want to take us to the next slide because we have an opportunity for y'all to get even more engaged in the work that we're doing. We know that we need to stop Rubio and DeSantis in 2022. They're harmful for our kids. They're harmful for our state. And so we're inviting everyone to join us at the Blue Future Fighters team. That's our volunteer team. It will be October 14th at 7 p.m. on Zoom. And we will have the link for y'all to sign up in the comments. So please sign up. It's an incredible program. I think we have the best volunteer program in the state just because, well, I'm on the team. So that's why I consider it the best. But we also have the amazing, incredible Juan and David, who my colleagues who are just phenomenal at the work that we do. So we would love to have you join us. And before we hop off, I would love to hear from Lisa and Allison, like how can people stay in touch with you and your organizations? And we can go to the next slide.
Lisa, you can go.
Okay, sorry. I'm recovering from a cough myself. Thank you. You can always go to Common Ground FLA on Facebook. We will continue to support the efforts. And I agree with you. For a Future continues to just bust out incredible opportunities for folks on the ground to engage with. We have calls to action as well that will be coming out, especially as legislative session approaches. And I would recommend just visiting us on Facebook, checking us out. We are definitely going to be holding our state level legislators accountable as we head into 2022. And there's going to be a lot of movement this legislative session that I think that we really need. We're going to need a lot of folks paying attention and a lot of voices at the table. And so I appreciate the efforts of For Our Future, and then just continuing to check in with us at Common Ground and seeing, as we evolve, we'll be doing some trainings and advocacy assistance in case somebody's, getting into this for the first time. They've never done it before. You're always welcome to reach out to us as well if you have questions about any of this stuff, how to access some of the resources that are available. And yeah, sorry, I'm just trying not to cough. I'm going to pass it over to you, Allison. Thank you.
So as is on the slide, floridahealthjustice.org is our website, and we are also on Twitter and Facebook and Instagram, and our handle on all of those is FL Health Justice. Reiterating what Lisa said in terms of reaching out to legislators, we're going into the state legislative session in a couple months, but at the same time, we're in this really critical moment right now in Washington, and Congress is making some very big decisions that are going to affect all of us as we speak, deciding on the reconciliation budget package, which we hope will actually include a fix to the coverage gap, as well as other really critical services for kids and families, and addressing healthcare and home and community-based services. And if you haven't already reached out to your member of Congress to let them know how important these issues are, right now is the time to do that. Let them know that you want to ensure that the reconciliation package has a fix to the coverage gap. And if you have time to send another email or two, send them to Senator Schumer and Nancy Pelosi to let them know that these are priorities for Floridians. So thanks again for having me. This is, you guys are everyone's doing amazing work, and it's exciting to be a part of this conversation. And I'm glad that you were recognizing Child Health Day.
Awesome. Well, wanted to say, if you want to stay in touch with For Our Future, you can join one of our Facebook groups. That's forflorida.us/Facebook groups. We stay connected, share news articles, share events that are going on in our region. So definitely join those Facebook groups if you want to stay connected with us. I want to take a moment to thank our guests for being here today. Allison and Lisa, cannot thank you enough for being on and bringing your perspective today. We're just lucky to have like two of the most powerhouse women in the state of Florida with us today. So thank you so much. And we appreciate you for being on with us. And we want to thank our viewers as well and hope that everyone has an amazing day. And thank you for watching this in honor of Child Health Day.
Later, Gators.
Thank you so much.
Thank you, everyone.